Hello, my name is Carly. I'm going to be showing / telling how to do the wet and dry wound dressing change. So first I'll do is ask the patient, what is your name and date of birth?
Mark Rodriguez, 9/22/1997.
Okay, I am going to perform hand hygiene. I've gotten the information pulled from his record, the last recorded location and exact size that they had of the wound last they did a dressing change. Are you comfortable? Are you feeling okay the way you're sitting? So everything's good like this? Okay. All right, let's see. We're going to review the order. Just reviewing the order. All right. Do you understand everything? You understand we're just doing the dressing change to make sure it stays clean and to facilitate healing. Keeping it clean is also making it less likely to become infected. You understand that, right?
Yes.
Do you have any questions about why we do dressing changes?
No.
All right. Let's see. I've already assessed him and asked questions I needed to for the risk of delayed or poor wound healing. I am going to go ahead and explain to him what I'm going to be doing. So simply what I'm going to be doing, I'm just going to be removing your old dressing. I'm going to be cleansing it and putting your new dressing on. So it should be relatively quick and it should be painless. You just let me know if you feel any discomfort or anything. Do you have any questions? Okay, so we gave him pain meds 45 minutes ago. We want to do dressing changes between 30 and 60 minutes of getting analgesics for the discomfort that it may cause. Since his pain meds have kicked in, he should not be in any discomfort during this at all. So since his arm is where the wound is, it's not as important for us to make sure and have the area around it covered. He's told me that he's comfortable with having his arm exposed. So the patient's already told me he's comfortable. I'm going to make sure we have privacy. I've got the curtain pulled. Do hand hygiene. I just did that. And now I'm going to go ahead and put on my gloves. That's the only PPE that I need for his dressing. I'm not at risk of, it having any liquids come out. He doesn't have any diagnosis that caused me to need to wear any more PPE other than my gloves. If I can get my glove on. So I'm going to go ahead and put a disposable bag next to us. I'm going to roll the edges down and make it cuffed around the edges for the garbage so that I can sit it in there very simply. So make that super easy. So now I'm going to go ahead and start to remove his bandage. So I'm going to remove the tape around it. Just loosening the tape up. And then this dressing that he has on is only one layer, so it'll be very simple. So I'm just going to remove this layer. And it's removed. I'm going to drop this into that cuffed bag. I'm going to go ahead and take a look at the wound. Just see. I don't note any difference in drainage. It does look a little bit smaller. Move this over a little bit, sorry. I don't see any new edema. Nope, looks good. Okay, so I'm going to go ahead and discard of these dirty gloves straight into that bag next to me. I'm going to go ahead and perform hand hygiene again. And now I'm going to open the sterile dressing. Just opening it, sitting it here. He's been switched to a moist dressing. So this gauze has been wet with sterile saline. I'm going to go ahead and I'm going to pretend this is the bedside table for a moment. Just putting my sterile gloves on. Okay, so I have my sterile saline solution. So I have a towel under the patient's arm. It just says cleanse. We're not rubbing on the wound or anything. We're just simply pushing small amount of saline to rinse. The orders were very clear. Okay, I'm going to drop this into my bag. So we did the 3 mLs of saline that were specified in the order. I'm now going to grab one of my sterile wet gauze, and I'm going to place this over the wound. And then we're doing a similar bandage to the one that he already had on. This patient in particular has a lot of skin sensitivities. So we're going to place this, and then the doctor actually prescribed paper tape to hold it. So we're just going to do that. And then I will go around and secure this a little bit better. So, since we did the wet dressing, once we check it next time, something we'll do different with the wet dressing is we'll check around which we're going to check the whole site, whether it's wet or dry. But with the wet dressing, you check around the site just as much as you check the site because of just the wetness and it all being damp in there. You want to make sure that that dampness isn't causing any more spreading or any further breakdown. So for the dry dressing, it's basically the same. Trying to think if I've missed anything. With the saline, with the wet ones, you wring it out and make sure it's not dripping wet. You wring it out to where it's just moist. You don't want it dripping down the patient's arm when you put it on. We secure the dressing properly depending on order. So it may come with just a simple dressing that has the adhesive borders that can be put on simply. This patient happens to have a lot of allergies to those types of dressings. So the doctor went ahead and ordered the dressing and then just me to secure it with paper tape because that's one of the only things we found that this patient is not allergic to. Once I'm done, you just remove the PPE, drop it all in this bag that I cuff the edges to, and I'll label it. I'll put the time and date that the dressing was changed so the next nurse that has to change it knows, and wash my hands when I'm done. And I think that's it. Are you comfortable, sir? Yes?
Yes.
All right. So you would help the patient into a comfortable position if needed. We would, what else would we do? I would record everything in the patient's chart that I did. Oh, are you having any pain right now?
No.
No. So on a scale of 1 to 10, your pain is 0, no pain?
Yeah, 0.
Okay. All right. I think we are done.